2 months after the Dayton Peace Accord was signed by the warring factions of Bosnia and Herzegovina, there was still an atmosphere of siege in districts of Sarajevo close to the old front line. The Dobrinja Hospital now caters for victims of disease and accidents. It wasn't equipped for emergencies before the war broke out in 1992. It was just a small doctor's practice. It became a war hospital overnight out of necessity.
I remember first night when I came, I operated 10 people on floor with 2 candles and with dental instruments because I didn't any surgical instruments here. At the beginning I worked alone, but later in July I think I had 27 doctors working with me. So we formed General Hospital, Dobrinja, and it works very good during this war, because we treated here about 12,500 injured people from war injuries, and double more of various pathological situations.
The World Health Organization, WHO, has long played a role in the region, but the onset of conflict brought new demands. Advising the authorities on matters of public health was no longer enough. Offices were established in key areas to tackle the crisis and coordinate help. It was the first time, at least in the European region, that WHO had moved to wartime humanitarian assistance. Yet the operation had started in a more traditional way, at the request of the High Commissioner for Refugees to advise UNHCR on health-related issues. This hospital took several direct hits during the siege of Sarajevo. Conditions were so bad at times that staff were injured. Shelling, power failures and the collapse of sanitation systems all took their toll on the infrastructure and on people. By adopting a hands-on approach, WHO could help existing health systems provide a basic level of care and avoid serious outbreaks of disease. From early on, the organization became a main provider of medical supplies and equipment. It also acted as coordinator for the many agencies involved in relief efforts. Not an easy task, given the intricacies of the situation.
In the years ahead, and we hope that we can
Dr. Joe Asval is WHO's regional director for Europe.
The second is that Bosnia, like all the countries in this part of Europe, of course came from a specific past. It was part of the communist system, if you like, which had its very specific characteristics. The communist system, for instance, had a health care that reached everyone. It had a clear cooperation between the primary care level and the hospital level, and it had a logically constructed hospital system so that resources could be planned in a rational way. And many countries don't have that today. But many other things were not good. It was certainly not well-managed systems. It was certainly not systems that involved people in local communities. And it was certainly systems that were much too medically oriented, not enough understanding the complexities of society.
The war put plans of reform in abeyance. Immediate needs had to be met, while shifting front lines often hindered the delivery of supplies. New routes must be found. This deep seaport became a landing post last year. NATO raids were endangering airlifts from Croatia to Sarajevo, so UNHCR redirected its supplies to Ploče harbour and a warehouse nearby. WHO followed suit and planned to continue sharing the facility until storage for central Bosnia could be transferred to Sarajevo. An expert on women's health surveys a consignment destined for the community-based clinics of the post-war era, when reproductive health is made available at the primary care level. With peace, the emphasis can begin to shift to long-term planning. There's a new optimism, and thanks for the help given in the thick of conflict.
Every time we asked for assistance, we always received it.
But there's no room for complacency. This building is a former students' hostel. It's due to revert to its former use in June. However, it's still home to 350 displaced people who lost all they owned. WHO carried out a survey on nutrition here 2 years ago, but there's little evidence of recent involvement. This comes as no surprise to Dr. Janssen. He explains why.
We are not that visible. Our main role in the field and also here in Sarajevo, it's to coordinate the assistance in health. Yeah? So we are not really, let's say, direct service providers like other agencies do. Yeah? We give supplies, but we try to work through the existing systems, the existing health systems.
War no longer rages, but the conflict has left a trail of sorrow and despair, which will have an impact on the whole region for years to come. 200,000 people killed and missing. The human cost can't be overestimated. Many atrocities have been committed since the war started in April '92. Millions of people who used to live together peacefully now hate each other. This was painfully evident again recently. Some Bosnian Serbs had set fire to their own homes before leaving. They faced an uncertain future as they headed out of Sarajevo suburbs. Only a few chose to remain in a city now controlled by a new Muslim-Croat federation. Meeting the terms of the Dayton Accord has proved a tough assignment. The deadlines set by the implementation force have been met so far, but at what price? Hopes of maintaining or re-establishing ethnic variety and harmony are receding. Sarajevo, now reunified, is licking its wounds. Jasna Sakovic works for WHO. She and her husband were separated by the war for 2 years. When safety became critical in '92, she and their 2 sons moved out, along with many others. They came back in September '94. 18 months later, the peace had been signed, but war had left its mark. Gas supplies were restored only recently, and most services taken for granted in much of Europe remained erratic months after Dayton. Running water every other day, safe water, maybe soon. But dreams can come true. For Jasna's family, the way forward's clear.
I think that the future for my children will be here in Bosnia. They will be educated here in Bosnia, because I don't want for them to be a refugee, to be a foreigner. In any other case, in any other country, they will be that.
Many people were displaced by the war. 1.25 million emigrated. 200,000 came in from outside. Of a total of 2.5 million now living in the Federation, about 600,000 left Serb-held areas. 250,000 became refugees around Tuzla alone. They fled their homes after the fall of Srebrenica in July. 1,000 live on this estate, built with funds from the Norwegian People's Aid. A doctor's surgery, equipped by WHO, operates 3 days a week.
Indeed, when you think about reconstruction,
WHO is now the government's main advisor in health development.
It's very clear that reform of the healthcare system, rebuilding of the healthcare system is dependent in a fundamental fashion on rebuilding of the economy. The key challenge is, of course, is what can happen in the short term until the economy gets back on its feet. The World Bank is committed to providing an important infusion of funds into the economy. The European Commission is committed to helping to rebuild the economy. And the progress in this part of the world, whether you're looking at the health sector or any other sector, is dependent upon the investments of those large institutions in the economy overall.
The task ahead is enormous. Hundreds of thousands have experienced at first hand the horrors of war. These families have been relocated in a primary school some 20 kilometers north of Tuzla. 30 people live in each of the 6 rooms available. Most are from Srebrenica. They say they no longer have homes to go back to. They're totally dependent on humanitarian aid. Damir doesn't know where his father is. His dearest wish?
I hope to go my home, but I don't like here.
Some mental health experts believe a whole generation of children and their children after them will be at risk.
We know from the experience from the Second World War that the children and even the grandchildren have a higher frequency of traumatic stress problems. So what we are going to see here in these countries, I think it's not people standing in a lane waiting to get psychotherapy. what we are going to see is a massive increase in alcoholism, drug abuse, domestic violence, criminal violence, suicides, homicides, and a lot of threats to the health.
From a few field offices staffed with a handful of professionals, WHO mobilized local psychotherapists and started training the trainers during the conflict to help communities help themselves out of the worst mental health disaster seen in Europe since World War II. Up to 1 million people may be in need of rehabilitation in the former Yugoslavia, including the carers themselves. There's physical injury to overcome as well. Amputees in the Tuzla region are referred to the orthopedic section of the main hospital. The department has 26 staff, including nurses and physiotherapists, and more than 1,000 registered patients, several hundred of them amputees. There are war wounded, but also victims of diseases or of traffic and industrial accidents. A shoemaker until 3 years ago, Ivan Dukovic retrained to make artificial limbs under a scheme run by Handicap International. WHO provided supplies, while funding organizations included War Child and UNHCR. There are 4,000 to 5,000 amputees now in the former Yugoslavia, but numbers will increase dramatically as civilians return home and resume their peacetime activities in areas peppered with unmarked landmines. WHO is making people aware of the hazards. As demarcation lines between feuding factions moved back and forth, empty houses, too, were booby-trapped. From post-emergency to long-term development, a new community centre in Mostar, funded by the European Union and WHO. The Mostar field office is the youngest. But things are particularly tough here. Tensions are palpable between Croats on the western side and Muslims in East Mostar.
The problem here is that especially the men who have been soldiers and who are wounded in war, who need rehabilitation, don't dare to come from the west side to east side yet. But hopefully it will be better.
Some people say it's not that they don't dare, it's that they don't want to. The town carries all the stigmas of a conflict in which Muslims and Croats fought side by side against Serbs and then against each other. But there's a glimmer of hope. Reconstruction is underway. A new youth centre for both communities, and within it a film club, the brainchild of Dr. Ambrosio Manenti, head of WHO's field office here. Supporting cultural activities may contribute new ideas to the reconciliation process, and backing from big financial institutions may bring economic recovery and new prosperity. Much of Mostar's historic centre has been damaged or reduced to rubble. In the present climate, few would be bold enough to predict the future, at least not here. Yet hope lies with all those who believe in the link between health and peace. The time has come to rebuild bridges in Bosnia and Herzegovina by trying to maintain and promote public health across all boundaries. The health professionals have shown the way.